How's it going, guys? Medium difficulty question, musculoskeletal step 1 internal medicine 2CK. 60-year-old man, he's got osteosarcoma. So the arrow's pointing to Qbank triangle, which is subperiosteal/periosteal reaction. If the vignette gives you 15 lines of nonsense and somewhere in there they tell you there is no subperiosteal/periosteal reaction, that's their way of telling you it's not osteosarcoma if you're not sure of the diagnosis. Star is our sunburst appearance, okay, spiculated new bone formation. So I'll talk about the diagnosis as we move through the clip. Choice A, ball and valve murmur, wrong fucking answer. Very buzzy for cardiac myxoma, most common cardiac tumor in adults. It could, of course, be, in theory, cardiac rhabdomyoma, tuberous sclerosis in kids, but they'll usually give you a diastolic murmur. It can be systolic. It's usually diastolic murmur that will abate with change in positioning of the patient. Okay, just very buzzy for cardiac myxoma. Wrong fucking answer. Choice B, cardiac amyloidosis, wrong fucking answer. So amyloidosis means protein depositing where it shouldn't be depositing. And I've made innumerable clips on this straight from my cardio PDF. Most common cause in USMLE is multiple myeloma. It can be things like autoimmune disease. I believe I've seen one question with rheumatoid arthritis. Students get emotional about amyloidosis. They say, oh, can it be thyroid? Can it be diabetes, etc.? I mean, in theory, but when we talk about what the USMLE actually wants, multiple myeloma is the most important cause. You have neoplastic plasma cells secreting IgG kappa lambda light chains, which are immunoglobulins. Immunoglobulins are proteins. So they're depositing in the kidney, which is going to cause renal amyloidosis, nephrotic syndrome with Bence-Jones proteinuria. Deposit in the heart, cause cardiac amyloidosis, diastolic dysfunction. Wrong fucking answer. Choice C, decreased mineralization of bone, wrong fucking answer. So generic answer choice could refer to rickets, osteomalacia, vitamin D deficiency, kids, classically Europe. Could be alcoholics with liver dysfunction, okay, so can't synthesize 25D3, so they'll give you a down arrow for 25 and a down arrow for 125D3 in alcoholics. Could be renal dysfunction, okay, where you can't synthesize 125D3. Okay, you get renal osteodystrophy, which is osteomalacia. Conversely, they can write for rickets osteomalacia, increased unmineralized osteoid. Choice C, wrong fucking answer. Choice D, pansystolic pandiastolic murmur, aka continuous murmur, aka to and fro murmur. Correct answer. Patient has Paget disease of bone. Okay, so patient has high output cardiac failure here. Now, I've talked about, actually in the last YouTube clip I put out, that there's 3 demographics for osteosarcoma. Number 1 is going to be idiopathic males, 15 to 35. Number 2 is going to be retinoblastoma. Congenital retinoblastoma is they give you a kid under the age of 1, he had an enucleation of the eye. They say, what's your risk for later in life? The answer is going to be osteosarcoma. And then number 3, Paget disease in elderly. Okay? Now, heart rate is high. You say, what's going on with the S3 and the S4? Someone actually asked about this in our Telegram group today. It's on NBME exams, okay? It's in my cardio PDF, where if you get the combination together of the S3 and S4, this is high output cardiac failure on USMLE, okay? So S3 alone, almost always systolic dysfunction, but you'd have a low ejection fraction. 55 to 70 is normal. So you'd have a low ejection fraction, not borderline high. S3 can also be high endurance athletes, can be pregnancy with higher plasma volume. S4 is going to be stiffened left ventricle. Okay, it's from afterload, usually systemic hypertension, can be aortic stenosis, can also be right-sided, rarely, where you have, let's say, mitral stenosis that backs all the way up to the right heart. But the combo at the same time, hypocardiac failure, and you say ejection fraction is not high, you just said 55 to 70. I've seen NBME do this. You can't be emotional about this, okay? You got to have some mental leniency or leeway, all right? So I've seen NBME do this, and this is just very buzzy for Paget disease, hypocardiac failure with osteosarcoma here. Let's just, and I'll say that the continuous murmur will be auscultated at any location where there's an AV fistula. There's a question where it shows up in the left ear for an AV fistula, a continuous murmur. You're like, why the fuck is it in the left ear? Great question. Okay. They can give you iatrogenic intervention where a patient had arteriography, let's say, of one of the legs. And then weeks later, there's a continuous murmur auscultated on the leg. Okay. So it just means you have an AV fistula. Let's hop to the final answer choice here. Responds to aspirin test. Wrong fucking answer. Obscure. Okay. I mean, it's not going to show up on USMLE. This theoretically could refer to osteoma, which is a extremely, basically non-existent bone tumor for USMLE purposes, that the pain can go away, can be mitigated with aspirin/NSAIDs. Okay. The tumor apparently secretes some prostaglandins. It's a factoid some students have mentioned before. They like to grab onto weird things. I haven't seen USMLE actually give a fuck about this detail. Choice E, wrong fucking answer. You know the deal. I'm to make more content, like my stuff, subscribe my channel. Appreciate your time. That's it.